in visiting with Governor Strickland last week, we had the ability, well, we were in Michigan when we visited. In Michigan, actually, before we came to your Ohio Own Your Future launch, we were in Detroit, in the Redford area, I think. We visited with the Presbyterian villages, nursing home and retirement communities out in Michigan, and it was very interesting to see that they were implementing. I actually met ladies that had lost their independence, had been on walkers for over 3 years, and were really becoming very frail. And they have gone, this is a wellness program that is really, falls prevention plus the physical activity, enhanced fitness models. Very simple models, very cost-effective to implement, but most importantly, it's powerful, the changes that is happening in many of the people. We saw a lady, this lady, and she's perfectly in good shape. She doesn't need a walker anymore. She's cautious. She's improved her whole physical and mental abilities. She's engaged. She's volunteering with the housing project within their complex. So you're seeing very important but very important scientific improvements in the health outcomes of those individuals. So again, as we said, we're not in the health care delivery system, but we're certainly in the business of health care. So we can help bring these kinds of simple tools so people can practice better health. Thank you.
Thank you. Long-term care is a special part to my heart. I've been in insurance for 17 years, and I specialize in individual, group, and long-term care and Medicare. One of the things that I'm kind of curious about is I'm part of a lot of different associations as health underwriters of Northeast Ohio. And the state or the government never comes to us to educate us as far as all the programs that you have. So as far as getting support group, support system, we really don't know what all of you are doing. And I would love to know more, especially about Western Reserve, that I could tell clients to go to, but I have no idea how to get to them. And then when we talk about consumers decide, in my experience, we've never really been honest with our country about these issues and these problems. So most seniors aren't really aware of what they're up against. I'm so happy that Ohio came through with our partnership program. That's super. That's going to be one of the best things anyone has that they can do now. But we're sending out a letter, but how are we going to get people to engage in these partnership programs and being honest with them that there's no money there? You guys have to take care of yourself. These are some of the programs for you to do with. Yeah. Please talk with a local agent or talk to someone that can give you the tools to go out there and do that.
Well, you mentioned something very important, and one of the most incredible opportunities I can tell you, having been in aging for over 30 years, we'll say it that, was the whole experience of going out on the road, meeting people across this country throughout 2 years, every week, being out on the road, sitting with people in their own homes, in their own kitchen tables, in rural Montana, as well as sitting in large community rooms in urban Chicago, and minority communities across this country. It was such a historic but such an important conversation that really began with the implementation of Medicare. We had difficulties, and there were challenges definitely as we rolled the Medicare benefit out. But it was an important conversation that individuals and families began to have around this issue, not just of health care. Well, people actually, I talked to sons and daughters across this country who told me, I didn't even know that mom was taking 10 medications. I didn't know that mom was having so much trouble paying for the medications that she had to choose between buying food. I didn't know that mom was at home and really was walking with a walker, and she really was afraid to go out. So it gave us the opportunity to really talk to people, begin this conversation about, what is this all about? it's not just retirement income, it's how do we want to be cared for if all of a sudden we become incapacitated. We know that we're not even doing advanced planning. We're not even doing advanced directives of if all of a sudden, God forbid, we would become disabled. Who would we want to live with or not? Or who would we want to help us care for ourselves? We don't want to even think about long-term care. You know, sort of we hosted a summit with the Governors Association, and we had a couple of interesting speakers, and one of them was Newt Gingrich, who happens to be one of the most interesting speakers as it relates to aging and long-term care and some of the challenges of an aging nation. And, you know, the partnership program that you mentioned and that was launched, the Own Your Own Future, will give you not only the toolkits going into the communities, but most important is that we are giving the ability for individuals to purchase long-term care insurance. And by the way, I just want a sidebar. Long-term care insurance is still a little bit out of reach to many Americans across this country. So we're working on it. This is another piece that we're working on. But it gives the ability of people to purchase long-term care insurance and save or protect about $500,000 up to $500,000 in assets. And what happens is then the state and the state Medicaid program becomes secondary payer. So when you exhaust your resources out of your long-term care insurance, then Medicaid kicks in. Now, the partnership program and the Own Your Own Future that you just launched a week ago will give you not only the kits, but will give you the information of all the resources that are available, including long-term care insurance. And by the way, there's other products that are being developed, and they're on the pipeline. Hybrid long-term care life insurance policies, etc. So these will give you the opportunity to be able to help you choose and opt for the kinds of services and supports that you might need.
Today at the City Club of Cleveland, we've been listening to the Honorable Josefina Carbonell, Assistant Secretary for Aging at the Department of Health and Human Services. Thank you to our Assistant Secretary. Thank you, ladies and gentlemen. We are now adjourned.